Hello, everyone. Today we are going to talk about spirituality, occupation, and the physically disabled. This presentation is brought to you by Salma, Naomi, Wayson, Sarah, Leslie, Ashley, and Alyssa. First, we're going to have Salma introduce OT's role in physical disability.
Okay, so OT and the types of physical disability. So I have narrowed down amputation, spinal cord injury, stroke, and with these type of disabilities, we're trying to identify the client's functional goals, which can include self-care, home management, work tasks, driving, childcare, leisure activities, and offering modifications to complete these goals if required. You're helping with hemiplegia or right or left weakness or neglect when you're dealing with like CVA stroke patients. You're analyzing tasks and providing modifications to achieve their goals. You're providing education or maybe compensatory techniques and equipment to accomplish their tasks. You're providing prosthetic training for amputation patients. In their acute phase, you're pre and post prosthetic training, so it depends on which stage they are in their amputation. You're identifying and addressing psychosocial issues. So there's definitely a strong relationship between functional status and whether their injury is complete or not complete, even when dealing with spinal cord injury. So next we're going to have Alyssa talk about physical disabilities across lifespan.
Thanks, Salma. So now we'll talk about physical disabilities across the lifespan. So ranging from childhood to end of life, there are different disabilities that are more common within different age groups. In childhood, you're more likely to see cerebral palsy, spina bifida, brachial plexus injury. For young adults, middle adults, it's more common to see acquired or traumatic brain injury, spinal cord injury, or muscular dystrophy. For older adults, end of life, it's more common to see lung failure, heart failure, or stroke. And of course, we don't want to negate that mental health that inevitably does come with physical disabilities. For children who have physical disabilities, they tend to be at a higher risk for poor mental health. And that could be because they're in school, they might get bullied for the way that they look with their disability. And then this study also showed that girls and adolescents who come from a low socioeconomic status are at even greater risk for poor mental health. And then another study showed that social support in adults is important, but the direct effect on mental health and well-being is minor. So it does have a benefit indirectly, but that social support doesn't directly affect mental health in a positive way. For older adults, disability is a risk factor for depression, and women are more affected, the study shows, and they were positing that cohabitation or a spouse could be a protective factor. So thank you, and I will turn it over to Ashley for OT's role.
Next up, we will be discussing occupational therapists' role in spirituality with persons who have a physical disability. As cited in the American Occupational Therapy Association in the Practice Framework, Puchalski defined spirituality as the aspect of humanity that refers to the way individuals seek and express meaning and purpose, and the way they experience their connectedness to the moment, to self, to others, to nature, and to the significant or sacred. Spirituality is considered one of the main components of care that an occupational therapist can work on with a client. For someone who is or has recently become physically disabled, spirituality is something that can be focused upon that requires little bodily movements. Some may even redefine how they view spirituality during this time. Another important aspect of the OT role is to provide client-centered care. As we have learned throughout several readings and discussions in this class, spirituality and its definition and meaning are different to each and every person. It is our job as occupational therapists to give each client what is meaningful to them. However one may view spirituality, it is absolutely within the OT's scope to provide that individualized care. Next up, Wison will be discussing how spirituality and occupation in everyday life are interconnected.
So does spirituality and occupation have a reciprocal relationship and help people make sense of life? Studies shows that engaging in meaningful occupations could nurture one's inner state. Wolowski and Wacko in 1994 argued that the active planning doing of an occupation could give meaning to the participants and create a sense of spirituality. In the reflection on spirituality and occupation, gardeners adjust the close relationship between the two. By actively practicing gardening in daily life, gardeners reported that they found it with spiritual dimensions. Some see working in a garden provides them a private and peaceful place to get away from the chaos. Some enjoy the participation in the life process of planting as they bring hope and expectation of next year's outcome. Some gardeners found happiness with the color and smells of the plants as they brought back memories. Some found gardening bring them a community full of passionate gardeners. In a study that examined the spirituality and life satisfaction in adults who are physically disabled due to spinal cord injury, Kalam found about half of the participants emphasized the importance of religion, and 55% of them used the spiritual coping in daily life. According to Kalam, spiritual coping enhanced the satisfaction with life for people with physical disability and highly associated with the elder population, as many of them use spiritual coping strategies. The study suggests that assessment of spirituality should become part of the care. Spirituality-focused intervention could be beneficial for people with physical disability. So in the next slide, Naomi will further explore the support and barrier of spirituality.
Thank you, Wai-san. Hi, my name is Naomi, and I'm going to share some concepts of supports and barriers to spirituality within the context of physical disability. So the first factor we're going to explore is pain and suffering. Pain and suffering can act as both supports and barriers to spirituality, in that pain and suffering can serve as barriers of discouragement to one's spiritual engagement, but alternatively can also serve as catalysts, and this depends on the individual's personal life experience and how they perceive their process of physical disability. The second factor we're going to explore is coping. Spirituality can serve as a method of coping, a powerful resource that provides comfort, peace, resolution, meaning, and the process of making sense of one's life challenges and life process. Now, this can be especially meaningful within the context of physical disabilities. There are also cultural aspects to be considered, and it has been noted that culture makes a significant difference in how people experience spirituality. Cultural kindling, coined by Parker in 2014, describes the way people think about everyday experiences, and culture can play a part in this, especially in regard to physical disabilities. Now, culture can impact one's perception of physical disability for the better or sometimes for the worse, depending on the aspect of culture. Other concepts to explore are societal expectations, primarily the concept of being and becoming. Being describes the body and its relationship to self-awareness, to self, and to society, and becoming focuses on the intended and socially acceptable selves and the life worlds, each vested with a teleology for continued development of the self and social life, essentially exploring where an individual fits into the world and how the world fits into their own life scope. Other concepts include social challenges and social stigma, and sometimes individuals with physical disabilities have a limited ability to carry out socially expected activities and roles within various spheres of their life, and this can impact their own self-perception as well as the world's perception of them. Now, the ADA describes physical accessibility for individuals with disabilities. So challenges can come from a lack of accessibility to religious or spiritual buildings, but alternatively, if a building or institution is accessible, this can promote spiritual and religious engagement. As far as advocacy goes, there are organizations that advocate for individuals with disabilities to have the right to choose their own expressions of spirituality, to practice those beliefs and expressions, and to participate within the faith community of their choice. So this recognizes that spiritual and religious activities are an important aspect of life, and that some individuals may need some accommodations or adaptations, whether that involves assistance from a device or more planning in advance. And now I'm going to pass it on to Sarah, who's going to tell us about tools and assessments.
Thank you, Naomi. Today I'm going to be talking to you about some assessments and tools that can be used to gain some insight into the background of our client's spirituality. So for the first an assessment that I'm going to discuss is the DSES, which is a 16-item self-report measure that's used in research, organizational, and clinical settings. It focuses on awe, gratitude, mercy, sense of connection with the transcendent, and compassionate love. It is helpful in tracking how spirituality is affected over time, which is why it's very helpful for helping our population of those who are disabled, as it's able to gauge how our clients' spiritual growth has changed over time. The next assessment that I'm going to discuss is the Occupational Therapy Spiritual Narrative Assessment that is unique to the concerns of occupational therapists. It focuses on personal values and beliefs, coping, community connection, and referrals that OTs can provide for our clients. This is especially helpful if you need to figure out exactly what kinds of sources our clients need help with. For our last assessment that I'm going to discuss is the HOPE questions, as it is a good teaching tool to help medical students, residents, and practicing physicians begin the process of incorporating spiritual assessments into the medical interview. This assessment is very helpful because it begins with a more sensitive approach by addressing sources of hope, meaning, comfort, strength, peace, love, and connection, and works its way into deeper topics such as role of organized religion for our patients, and also then personal spirituality and practices, and lastly, the effects on medical care and end-of-life issues. So this is an especially helpful assessment for those that are disabled, as it comes from a very sensitive standpoint and would be appropriate to use for our population. So thank you so much, and I'll let Leslie take it from here.
Now we're going to go over a case study. So Richard is a 31-year-old man currently living with his parents. He has been on parole for 1 year with a felony charge of drug use and sale. During one of his drug uses, he was driving a car and ended up crashing, which led him to sustain a TBI. He has been unable to see his children for 4 years, given that his ex-wife placed a restraining order on him. While in jail, Richard learned about Buddhism and journaling during his group therapy for addiction and felt uplifted by the teachings. As a result of his TBI, Richard presents with weakness and uncontrolled movements in his left upper extremity. He fears that his children will see him less of a father due to his physical condition, so he often turns to Buddhism as a coping mechanism. When he was released, he was referred to an outpatient OT clinic to help him get his life back in order. His motivation for therapy is to see his children and stay out of jail. His parole officer's primary goal for him is to stay away from drugs and get a job. As an OT, what steps should you take? So for this case study, we would utilize a holistic approach. This includes reviewing medical records, family history, personal narrative, life turning points, physical health, nutrition, and social relationships. And then we would use an assessment tool that can explore Richard's spiritual environment. The HOPE assessment can be used to see how Richard uses Buddhism to cope with his struggles of daily challenges, and it also provides a framework for what he was trying to accept and make sense of his own life. And it is important to understand one's own spiritual grounding as a therapist. The OT must maintain a balance between understanding and developing a person's spiritual strengths while focusing on treatment goals. They also must be aware of their own spiritual beliefs and practices and how those might influence their clinical interactions. OTs can contribute much to a person's change and growth by supporting the patient in his or her spiritual environment. By listening to the unique needs shared by the patient, OTs can work closely with the patient to identify the values, beliefs, and practices that can encourage recovery. Thank you for listening. We hope you found our presentation interesting and informative.